Hello, welcome to our mock interview group project for Henry Ford College Nursing Course NSG 212, Transitions. The mock interview we will be performing for you will be conducted as a panel interview with students participating as panel members asking questions and another student playing the role of the interviewee answering questions during the interview. The team of students participating in today's presentation are myself, Andrea Ortiz, as moderator and interviewee, Brittany Spindleman is panel member and nursing recruiter, Antoinette Gordon is panel member and RN on the unit, and Stacy Lear is panel member and clinical manager. At the conclusion of the interview, we will enter into an evaluation process to discuss what worked, what did not work, and what we could have done to improve the interview process. Let's begin. Hello, Ms. Spindleman.
Ms. Ortiz, how are you doing today?
I'm doing well. Great to see you.
Nice to finally see you too, and finally put a face to a name. Come on in. Actually, my colleagues today are going to be joining us for interviewing today, okay?
Hi, how are you?
Hi, I'm Antoinette. I'm one of the nurses on the unit.
Hi, nice to meet
Hi,
you.
I'm Stacy Lear. I'm a clinical manager.
Andrea, nice to meet you.
Nice to meet you too.
All right, you can go ahead and have a seat.
Thank you so much.
And we'll go ahead and get started. So, you getting excited about graduating soon?
Yes, I am. It's very close. 21 days away.
Ooh, this is so exciting. So, as I know, you did go to Henry Ford College, correct?
Mm-hmm.
Okay, and how did you like the school there?
I really enjoyed the program. I really felt that even though it's an associate's degree, I really felt that they set forth a strong foundation for me, really helped me develop my critical thinking skills. So I'm just really excited to partner with a good hospital that, our mission statements align and be able to apply the skills that I've learned.
We have a lot of nurses on the floor that are from Henry Ford.
Oh, really?
Awesome. So, I'll go ahead and get started. Tell me why you wanted to become a nurse.
Well, in 2010, my mom had a really bad stroke. She had a CVA.
Oh, I'm sorry.
That kind of began my role of really caretaking for her, and it was a 2-year process where she went from completely bedbound, maximum assistance to we worked for 2 years on her rehab with PT, with OT, partnering with her healthcare provider, because once she was discharged from the hospital, she went to subacute, then she went to came home. So there was a lot of care to be done. We had OT and PT coming to my house, and it was really great. It kind of sparked my interest. I was able to learn how to manage insulin and how to check blood sugar and how to check her INR bedside using a monitor. So it kind of started to spark that interest of maybe I could make this into a career. So.
Right, nice. And, okay, so if you had an article in the New York Times about you, how would you describe yourself in 3 words, using only 3 words? Which would you choose?
3 words. I would say that I am dedicated, I am humble, and I'm optimistic.
Oh, nice.
Okay.
I like that, optimistic.
3 good qualities.
Perfect. Okay. And how would you describe your nursing philosophy?
Well, I reviewed your website last night to prepare for the interview today, and it's part of when I was first searching different hospitals or organizations that I was interested in working for, it was part of what drew me to your hospital was the philosophy of the hospital, because I feel like my own philosophy of how I approach my nursing is really correlates well with that. Focusing on that compassionate care, that individual care for each patient, being able to advocate for that particular patient in front of you, holding myself accountable. That's very important for the care that you deliver, making sure that it has that quality behind it. So,
okay. And in your own words, how would you define professionalism in your own words, though?
Professionalism for me means being reliable. It means being punctual. It means being flexible. You have to be able to fit many different situations. if you have a hostile patient or a situation perhaps where you need to be able to reach out to someone else and you need to be able to use your resources. That's professional. Leading by example is huge. I think that is, there's been organizations where I've worked for where perhaps the professionalism wasn't up to the standards that I felt it should be. So in those situations, I just like to lead by example, and I'm not going to lower my bar because of the surroundings. So I think
that's very important.
Well, defines professionalism.
Very important to keep the bar high and to make sure you're always aware of that. So actually I'll finish with my questions. I'm gonna let my colleague Antoinette start.
Okay.
So my very first question is going to be about teamwork and how well you fit into a team. We're all about that on the unit. Another nurse may have a heavier load or it gets heavier within the day, and then other nurses, their load might not be as heavy. So with teamwork, we're always willing to help each other just to get the job done, get our patients the best care that we can. How do you see yourself fitting in our team, and how would you deal with a situation where your personalities are conflicting?
Well, I think that's very important, teamwork. It is one of the foundations that makes a good nurse a great nurse, is that ability to be able to work with other team members. And sometimes that might, as far as conflict goes, I'm a very bubbly, outgoing, animated kind of personality, but that doesn't work always with every team member, and it doesn't work always with every patient. So I've always prided myself in the ability to be able to read a room and be able to make those minor adjustments that are needed to be able to fit and flow with everyone. So I think that's very important. I think it's very important to partner if you do have a nurse that needs help to go ahead and help them. If you have a lighter load, that's what we're here for. We have to work as a team in order to get that quality care.
Great. As far as criticism, you're going to be a graduate nurse. In your clinical experiences, I'm sure you've had to deal with a lot of constructive criticism. Can you tell us a time where you felt really criticized and how you handled it?
Yes. Time management was a challenge for me in my very last med-surg clinical rotation. Our patient load is heavier, taking 3 to 4 patients on, and we have to report on 24-hour meds for the patients, all of the maximum dosages for the medications, the side effects, adverse effects, the whole shebang. So I was having a hard time with that. I was struggling with getting all of my patient care down to the quality that I wanted it, as well as being able to report on these 24-hour meds. So after I received the critique, I went home and I just came up with a game plan. I came up with a personalized report sheet that was customized for that hospital rotation that helped me out for that process. I typed up all the most common drugs that I had seen, typed up all their adverse effects, made myself a little document that I could keep so it was a lot faster to use as a resource rather than my actual med book. And that worked really well for me.
Great.
So
I like that.
And I developed your own plan.
Yeah, it really helped.
To go into, you said with your time management, prioritizing is key to nursing and getting things done. Can you explain a clinical situation where you establish priority?
That's a tough one. A clinical situation where I establish priority. Well, I had a couple patients where I think when you're going to be going off of priority, you need to look at the patients, get your handoff from your nurse, and you need to look at the patients on paper and see who needs you emergency right now after your assessment. You need to be able to hopefully do a handoff bedside if possible, so that you have the patient in front of you. And if you ever have a question about prioritization, if I ever do, I would go to my charge nurse, but I think that based on the patient's acuity, who is in immediate risk of airway, breathing, circulation, who just got back from surgery and needs that immediate assessment,
Yeah, back to the basics, yeah. Just final question. Pain is always an issue with a lot of our patients, as you know. And that's a lot of what the hospitals focus on is how can you control pain? So how do you handle a patient that's constantly complaining of pain and, you know, medications aren't working, for example? How would you handle that?
Okay, well, if medications weren't working, I would, first of all, with any situation, obviously we want to do an assessment. So I'd want to have a thorough assessment of that pain. I'd want to know where it's coming from, its duration, the quality of the characteristic, describing words. Is there any known alleviating factors? So I would start with getting as much information from the patient as I possibly could. Once I had that all gathered, if I've provided that I've already given them any PRN medications or any medications for breakthrough pain that were prescribed, if that didn't work, I'd probably try some therapeutic interventions as well, dimming the lights, being with the patient, empathizing with them, maybe a warm blanket, anything that I felt was appropriate. If that still wasn't working, I would have to go to the healthcare provider and see if there was something we could do to change the order or get something, share my concerns with him or her.
I'm gonna pass you on to my other colleague here, Stacy. She has a few questions for you.
One thing I was wondering, if we didn't have a current opening right now on our medical surgical unit, if you would take into consideration possibly taking a job on another unit, and if that was the case, what other areas would you be interested in?
Yes, I'm open to take positions on other units as well. After my experience with my mother, I have always been interested in like rehabilitation or a neuro brain injury type unit. I saw a lot of opportunities there when I was able to observe the nurses with my mom, how physical therapy only lasts for an hour a day. The patient comes back to the room, but the nurse has a great opportunity to extend that therapy by making sure they stay on the patient's side where their visual field is still intact, making sure they place the plate of food in their visual field, just little changes like that.
Okay.
I'm very comfortable helping them transfer and things like that. So.
Okay, so like a rehab or a neuro unit?
Yes, in med surg, I'm very flexible. I've also, you know, an IMC type unit as well too, interest in cardiac, so I'm very open.
Okay, that's great. How about, can you give me an example of a time where you acted as an advocate for your patient?
Yeah, this was actually my very last patient for my very last rotation ever at Henry Ford. I had this patient, I had a couple of patients. I had one who was an alcohol detox, ETOH, 4-point leather restraints. And then I had another patient who was an elderly lady who had been hypothermic for like close to 24 hours. So they both needed care immediately, but I really felt that it was important, again, going back to basics, that hypothermic patient to get her temperature up. But unfortunately, the nurse I was working with was just too busy to really hear my concerns. So I went to my instructor to see what we could do. You know, warm blankets wasn't working. No matter how many we piled up this lady, that just wasn't warming her up. We needed a bear hugger or something. So we went to the charge nurse, my instructor and I, and we were able to get that order in place. So we were able to get the bear hugger and it worked. So
that's great. Good job there.
So you utilized your resources.
Mm-hmm.
Yes, and then I was able to delegate some of the other care for my other patient to a UAP. And
that's also showing prioritization also.
Yes,
that's
yes.
great. That's a big part of it.
Mm-hmm. Okay, can you tell me about what you feel you could bring to our organization?
I am a very hard worker. I'm very dedicated. And I think that optimism I was talking about earlier when I described the 3 words, I'm very optimistic, and I'm always thinking on my feet. Again, I think that's something that the program I went to, Henry Ford, really helped me with, was really developing that beginnings of that critical thinking. And if there's something that I question or I don't know the answer or I need help with, I don't have a problem with utilizing my resources to make sure quality care. That's really is one of the things that drew me to your hospital to begin with, was your high standards for quality of care. I'm so interested in being a part of that.
That's great. Okay, so at this point, I feel like we've gone over your prioritization skills. We've touched on your definition of professionalism, your nursing philosophy. We've talked about ways that you advocate and deal with different situations. So going forward, do you have any questions that you would like to ask us?
No, I'd like to thank you all for your time with the interview process, and I guess I'm just wondering what's next. What can I expect next?
Well, we actually have somebody here that's willing to take you up to the unit for a tour, if you would like to take a tour of the unit.
Okay.
And while you're doing that, we can discuss here and then go from there.
Excuse me. Okay, that would be great.
Okay.
Okay, well, it was so nice meeting all of you.
Nice
Thank you
meeting
so
you all.
much for your time,
It's been great.
and I hope to hear from you soon.
So good to see you again
So
too.
nice to meet you.
Nice to meet you.
Nice meeting you.
Yeah, looking
Thank you,
forward to
Miss
hearing
Lear.
from you too.
All right, so let's begin our evaluation process.
Mhm.
Yeah. Excuse me.
Okay, so what do you guys think worked?
I think it flowed better this time around.
Did you? Okay.
I felt like our transition from introduction to fact finding to closing, I felt like it went more smoothly.
I did too.
I agree.
Okay.
What didn't work?
I really fumbled on a question. You asked me for a specific answer, a specific situation, and I gave you a generalized answer. I didn't give a specific.
I think it was the.
Was it a prioritization? I can't remember.
It was the priority question, but on my
Okay.
behalf, that question was not worded right. I stumbled over it.
Oh, you're so
I was
sweet.
like, and he answered. I was like,
Okay, what else? A little less ums I felt on my part. I caught myself in the beginning saying it, but I felt it.
I kept catching myself slouching again too.
Okay. Sitting up right.
And we did not offer a beverage or anything like that in the beginning, which we could have done.
All right. That's good.
Something different.
And if we had caught, an unanswered question or one that that didn't have enough of what we needed, we definitely could have asked, to more elaboration. Or a specific example.
That's a good one.
Other than that, I think we did better this time around.
Excuse me. Okay.
Good job, ladies.
Good job. I think that concludes our mock interview. Thank you so much for watching.